Hello everyone, good afternoon. Good afternoon, ma'am. I am Jazel Tikiseo, the first reporter, and our topic is the patient assessment. So these are the group 5 members. So let's define first what is patient assessment. So patient assessment commences with assessing the general appearance of the patient. It is use observation to identify the general appearance of the patient, which includes level of interaction, looks well or unwell, pale or flushed, lethargic or active, agitated or calm, compliant or combative, posture and movement. So, ang patient assessment, mao ni siya ang term nga gigamit to describe the process of identifying the condition of the patient so that the community responders or nurse or doctor will know what's the problem or injury of the victim or patient so that they will know what the first aid they will do. So, mag-observe ni sila sa general appearance sa patient. So, ang ilahang tan-awon ani kung okay ra ba siya or dili, kung namuwa ba sila or nang luspad, nakulbaan ba or kalmara. Tan-awon pud ang ilang posture o movement kung nabay problem, because this is one of the kanang signs or symptoms. So, mao ni siya ang patient assessment. It is to evaluate the problem or condition of the patient so that they will know what the needs of the victim or the patient. Patient assessment. After all victims in an area have been triaged and transferred to a designated treatment area, community responders will begin a thorough head-to-toe assessment of the victim's condition. During a head-to-toe assessment, look for the following. So, mao ni siya ang acronym DOTS, DOTS. So, D means deformity, O open wounds, T stand for tenderness, pain upon touching, and S for swelling. So, after ma-first aidan ang mga victims, i-transfer na sila sa designated treatment area. Dayon, ang mga community responders or nurse, mag-head-to-toe assessment na sila para mahibaw-an kung unsay mga conditions sa patient, kung okay ra ba sila or any kind of problems nga signs or symptoms nga ilahang mahibaw-an. And during the head-to-toe assessment, ang ilahang tan-awon ani is kaning deformity, if naay mga bones nga na-deform, and open wounds kung naay ang patient or ang victim naay kanang samad, kung nabay usamad nga nag-able, tenderness, if kanang inighikap nila or inigtan-aw nila, inig-check nila sa lawas sa victim is kanang sakitan sila, inighikap sa responders. And then swelling, kanang naghubag, kung namuwa nila nga mga parts sa ilahang lawas. So, I will show a picture example, guys. So, deformity mo na example. So, ang kamot sa victim is nahiwi. So, another example ani is iyang spinal. If nahiwi yung spinal, na-deform, maybe ang victim is na sagasaan or ang impact is kusog kaayo niya, murag na datogan ang iyang kamot or yung likod or something ana. And then next is open wounds, maybe ang victim or ang patient is kanang nasaksak or like nadagma siya or naigo siya sa mga nadagma siya niya, naigo siya sa kanang mga puthaw or something ana nga incident. Then next is tenderness, like inigtan-aw sa kanang nurse or the Red Cross nga dili nila masaka or hikapo nila ang bukton sa pasyente, isakitan sila. And then next is swelling, if mga namuwa or mga nabunog. So that's all of my report, guys, and then the next topic will be continue to my groupmates.
Good afternoon, everyone. I am Via Marisi Moradas from Bitaledo 1G1, and I will be your next reporter in this group. Let us talk about first the objectives of head-to-toe assessment, and next is what should be done in head-to-toe assessment. The objectives of a head-to-toe assessment are to determine the extent of injuries, determine what type of treatment is needed, document injuries, wear safety equipment when conducting head-to-toe assessment. So, ang tubong aning head-to-toe assessment, so ang una para makaibaw ta kung unsa kalapad or kadakon ang pag-spread sa mga samad or injuries na na-create or nahimo sa usa ka incident of a disaster. Next, after nato makaibaw sa kadakon or kalaparon sa injuries o sa man na na-create, kay now we can identify og unsa na treatment ang atoa i-perform para maayo kini or ma-cure. Ang third one, we need to document like mo-take ta og pictures and copies of all the records og unsa na injuries ang nakomit and the treatment that we need to perform to cure that kind of injuries so that all will be treated easily and goes perfectly and nicely. Lastly, we need to treat na jud ang mga injuries or sama that have been committed. So, sa pagkandak nato sa treatment para sa injuries, we need to perform the head-to-toe assessment jud. And most importantly, we need to wear the appropriate materials, which is the safety equipment jud, to perform the treatment well and successfully. So let us proceed to our next topic, and it is head-to-toe assessment should be. So head-to-toe assessments should be first conducted on all victims, even those who seem alright. Everyone gets a tag. Second, verbal, if the patient is able to speak. And third one is hands-on. Whenever possible, you should ask the person about any injuries, pain, bleeding, or other symptoms. If the victim is conscious, cadre, so kanang cadre di ay guys means kanang mga trained personnel on how to rescue and treat all the victims for their injuries in an incident caused by a disaster. Cadre members should always ask permission to conduct the assessment. The victim has the right to refuse treatment, then A. Pay careful attention, and B. Look, listen, and feel for anything unusual. So, kaning first, the head-to-toe assessment daw kay should need to be done and dapat ikandak sa tanang victims jud, bisan okay pa na sila, because we need to check all the victims jud fairly. Second, ang tanang victims need butngan og tag para sa pagkondak sa assessment for us to be able to know kung kinsa tong humana og check para sa ilahang assessment or wala pa. So, the third one, after kay atoa istoryahon or kumustahon ang mga victims verbally, if mo respond ba sila or okay ba sila. Lastly, hands-on means that you need to have an active participation in doing the head-to-toe assessment to all the victims. For the second paragraph, my explanation is that, so first, kay need nato mag-pay careful attention sa mga victims na ni-refused o pag-perform sa treatment kay right man na nila, so bantayan ng gyud nato sila carefully anytime. So second, look, listen, and feel anything unusual sa victims. So if we can see, hear, and feel that there is something wrong sa ato ang victims, and it is the time na mukol na ta og help.
By the way, my name is Jelena Alniepas, and now we are going to continue our discussion. So, to conduct head-to-toe assessment systematically, checking body parts from the top to the bottom for continuity of bones and soft tissue injuries in the following order. So, first is the head. Check the head if there is bleeding or injury and ask the person if he is okay or if there is pain in his head so that it can be treated right away. Number 2 is the neck. Check the neck if it is swelling or bruising. Ask him if there is stiffness or pain from his neck down to the shoulders, and if there is, locate the neck pain and find out if it is severe or not, as well as observe him if he has difficulty of breathing. Number 3 is the shoulders. To check the shoulder, ask the person if there is shoulder pain or arm weakness and examine if there is fracture or dislocation of his shoulder joint. Number 4 is the chest. To check the chest, inspect the entire neck, spine, and both the clavicles or the collarbone to find out if there is unusual movement, bleeding, asymmetry, and bruising, as well as find out if there is a broken ribs. Number 5 is the arms. In checking the arms, it is very important to ask if there is a severe pain and check the swelling or bruising area. Examine if there is deformity and any other arm injuries. Number 6 is the abdomen. Upon checking the abdomen, look if there is bruising of the skin and look at the sign if the patient can be able to stand and always vomiting. And also, if there is a bleeding, treat it right away. Number 7 is the pelvis. Assessment in pelvis should be performed with extreme care. Inspect if there is ecchymosis or bruises, deformity, asymmetry, and wounds. Number 8 is the legs. To check the legs, find out the sign of fracture, pain, deformity, bruising, and loss of normal movement or the inability to walk. Number 9 is the back. To check the back area, ask the patient if there is severe pain or sore to touch area at the back, as well as the pain that worsens with movement, coughing, stiffness, and difficulty of moving. So this is the order that we must follow in conducting head-to-toe assessment. Completing the assessment in the same way every time will make the procedure quicker and more accurate. Check your own hands for patient bleeding as you complete the head-to-toe assessment. Perform an entire assessment before beginning any treatment. Also, treat all unconscious victims as if they have a spinal injury. When conducting head-to-toe assessment, rescuers may come across victims who have or may have suffered closed head, neck, or spinal injuries. The main objective when community responders encounter suspected injuries to the head or spine is to do no harm. That is why you should minimize movement of the head and spine while treating any other life-threatening conditions. So before treating the person, it is very important to check his whole condition accurately by completing the head-to-toe assessment. When you see that the person bleed, address it right away. To the unconscious people, treat and examine them carefully. And in treating these injured people, pay attention and let them minimize their movement.
Good afternoon, everyone. So today, I'm going to report the signs of a spinal injury. So the signs of a spinal injury most often include: first, sudden change in consciousness; second, inability to move one or more body parts; third, severe pain or pressure in the head, neck, or back; fourth is tingling or numbness in extremities. So, magnam imong mga kanani tumoy sa imong tiil o kamot. So, fifth is difficulty breathing or seeing. Sixth is severe bleeding, bruising, or deformity of the head or spine. 7. Blood or fluid in the nose or ears. 8 is bruising behind the ear or battle sign. So, kaning battle sign is a crescent-shaped bruise that appears behind one or both ears. So,
9 is raccoon eyes or bruising around eyes. So ang kaning raccoon eyes is a condition that refers to bruises around both eyes. Um, 10 is kaning uneven pupils. So ang kaning uneven pupils or anisocoria is unequal pupil size. So the pupil is the black part in the center of the eye, and it gets larger in dim light and smaller in bright light. So 11 is seizures. So seizures is attack of illness, especially a stroke or an epileptic fit. So the last is nausea or vomiting. So mo niyang kaning kasukaon ka or kaning pagsuka. So next is victim found under collapsed building material or heavy debris. If the victim is exhibiting any of these signs, he or she should be treated as having a closed head, neck, or spinal injury. Keep the spine in a straight line when doing the head-to-toe assessment. So ang head-to-toe assessment DI is an exhaustive process that checks the health status of all major body systems. So, in an extreme emergency, ideal equipment is rarely available. So, the community responders may need to be creative by first looking for materials that can be used as backboard. So, mag-look silag mga materials na magamit as a backboard. So, ang backboard DI is to provide rigid support during movement of a person with suspected spinal or limb injuries. So, one siya ang door, iron board, building materials, anything that might be available para magamit as a backboard. So second is looking for items that can be used to stabilize the head on the board. So maning mga towels, draperies, or sandbags by tacking them snugly on either side of the head to immobilize it. So mag-look silag mga items na that can be used to kanaganing palig-on sa head sa victim para dili siya mapalihok. So kaning mga towels, draperies is magamit or sandbags magamit ni siya by itaod ni siya sa isig kilid sa ulo sa victim aron dili siya mapalihok. So yeah, that's it. For the next reporter will be Miss Novi.
Good day, this is Navalarain Hakorva. Let's proceed to lifting and moving of patient. Lifting and moving of patients means shift or transfer the patient from one place to another place with use of different types of devices. For example, wheelchair and street chair. We use this when the patient is not able to move or lift on their own. So, emergency move. When there is an immediate threat or to ill or injured person, for example, explosion, fire, unstable area, rolled over car, hazmat, hostile crowd, and spilled gasoline. When you must move a patient before making an assessment or immobilizing the spine due to hazards on the scene, it is needed to reposition the patient in order to provide life-saving care or in order to reach critical patients. There are 6 techniques of emergency move. First is shirt drag. Grasp the person's clothing behind the neck, gathering enough to secure a firm grip. Using the clothing, pull the person's head first to safety. During this move, the person's head is cradled by clothing and the responder's arms. Next is blanket drag. It can be used to move a person due to the severity of the injury. should not be lifted or carried by one person alone. Place the casualty in the supine position on a blanket and pull the blanket along the floor. Next is piggyback. The piggyback carry is used when a victim is responsive and not expected to lose consciousness. Piggyback carry by having the victim hold around your shoulders while you support their weight with your arms placed under their thighs. Next is one rescuer crutch. Rescuer holding victim around the victim's back and under knees. Next is cradle carry. Is used when the victim has little or no arm strength. It is performed by placing one arm under the victim's legs and the other around their back. The last is firefighters carry. The firemen carry lift the victim so that their torso is supported by your shoulders. Hold the victim by grabbing on their thigh with one hand and their arm with the other. So let's proceed to non-emergency moves. It is used to move patient when no threat to life. It is not used if patient has suspected spinal injury, internal bleeding, or uncontrolled external bleeding. There are three techniques of non-emergency move. First is extremity lift. Two rescuers lifting the patient by the extremities. One rescuer in the armpit, forearm, drag position, and the other holding the patient behind the knees. Next is direct ground lift. Two or more rescuers lifting a patient from the side. Last is improvised stretcher. Stretchers may be improvised by using two long poles, about 7 feet or 2.1 meters long, and strong cloth such as rug, a blanket, a mattress cover, 2 or 3 gunny sacks, or 2 coats. The figure here shows an improvised stretcher made from 2 poles and a blanket. So that's all the Group 5 presenter. Thank you for listening.